Good afternoon. This is Dr. David Cunningham from Infinity Family Care in Mansfield, Massachusetts. Today is Saturday, March 14th, and this is the first video that Dr. Wendy Cohen and I are putting together to help bring some understanding to the COVID-19 pandemic for our members of Infinity Family Care and anybody else in the larger community who might be interested. As you know, COVID-19 is the name given to the infection caused by a novel or new coronavirus first identified in late 2019 in China. COVID-19 is part of the same family of viruses that causes the common cold, as well as the more severe illnesses often known as MERS and SARS. We believe that COVID-19 is transmitted primarily through respiratory droplets from breathing, sneezing, and coughing, and it seems to be highly contagious in close quarters. The vast majority of those who contract COVID-19 have mild symptoms, generally including a cough, fever, fatigue, chest tightness, and maybe some mild shortness of breath. However, there is a significant percentage of infected individuals who experience more severe symptoms, including pneumonia and severe respiratory distress. Those at highest risk include the elderly and those with what we call comorbid conditions, such as heart disease, diabetes, asthma, immune system compromise, emphysema, and other serious illnesses. The combination of a relatively long incubation period and overall mild symptoms in most of those affected has led to a rapid spread of this virus worldwide. In the past week alone, there has been a significant increase in cases of COVID-19 statewide, nationwide, and indeed worldwide, and this is now being called a pandemic by the World Health Organization. In response, there has been significant administrative action taken both nationwide and statewide. However, this does not mean that any of us need to panic. The challenge for us is to bring a measured and timely response and to understand that there are things that each of us can do now to mitigate the spread of COVID-19 in our community and throughout the world. I think at this point it would be meaningful to note and useful to note the priorities related to the current administrative actions. Those priorities are: 1, increase the availability of testing so that we can more rapidly identify and isolate those infected with COVID-19. I plan to address testing-related issues in our next video. 2, fund the development of treatments and vaccines for COVID-19. Any vaccine for this specific coronavirus will likely not readily be available to the public until at least next year, given the need to perform rigorous safety testing. It's also important to understand that potential treatments for COVID-19 will likely come from already available drugs used throughout the world for other viral and intracellular infections. There are, in fact, studies ongoing throughout the world right now related to severe cases of COVID-19 looking at some of these medications. But number 3, and the most important for today's discussion, is to reduce the spread of COVID-19 through the closure of schools, the banning of large gatherings, and the encouragement of voluntary social distancing. And this is what all of us can do now. We truly believe that the most important factor that will determine our success in overcoming this pandemic is buying ourselves time. It is simply a matter of cold, hard math. The U.S. has just under 1 million hospital beds and approximately 100,000 ICU beds available. By some estimates, a mild to moderate pandemic would mean 1 million Americans requiring hospitalization and at least 200,000 needing intensive care. We only have 100,000 ICU beds and ventilators available. So we have a chance of handling this volume if those 200,000 ICU patients get sick over the next 3 to 6 months, but we will be quickly overwhelmed if they get sick over the next 3 to 6 weeks. More time also means more time for the development of effective treatment protocols and more rapid testing options. So how do you practice social distancing? Work from home, if at all possible. Avoid public transportation if you must go to work. Postpone non-essential travel, whether for vacation or for work. Consider cooking at home more and eating out less. And go outside and enjoy nature, primarily by yourself or with small family groups. That's it for now. I will be presenting some more videos as we go. And of course, if you are not feeling well, stay home, stay away from others, make sure you stay in touch with your primary care physician, and be safe out there, folks.